do you know what? When I think of dentures, I think of those adverts in the 80s or 90s of the woman trying to eat the apple,
Sterident.
or some sort of glue thing.
And the big,
How far have we moved on from those times?
Not as far as we'd like. We've moved into the situation where we can now place implants into bone, which are an implant. We've said in the past it's like a sort of screw going into the jawbone, and we can place I'm trying to think of the best way to describe it. It's almost like a press stud so the press stud gets fixed into the implant, and then you can have a denture. So if it's a full denture where there are no teeth whatsoever, the denture has a female part that pushes onto the press stud, like the male part, and that holds in place. For a dentist, it's one of the hardest things to make a denture. If you've got teeth and you're missing one tooth or 2 or 3 teeth, if there are other teeth available, we can use those. We can use those as support teeth. We can use those to stabilize the denture, stop it moving backwards and forwards, rocking. And they can have little metal seats that rest on your natural teeth. Once you lose all of your teeth, then everything has to sit onto your gum. Now, your gums are soft anyway, so it's very difficult to get something stable and firm on a soft base. So you can't rest a denture solely on the bone, because if you had no teeth whatsoever, if you had a piece of plastic that was sitting directly onto your gum and directly onto the bone, that would rub like crazy, and that's one of the biggest complaints we get. We'll make a new denture. It's very tight fitting, very close fitting. It's too close fitting, so that when the patient first wears it, it's probably like a new pair of shoes, feels like it's rubbing on your feet. So with a denture, it feels like it's rubbing, and if it's in your mouth, you can't get away from it, and it's sore all the time.
Peter, can I ask you, what is your denture situation? Have you got full dentures?
No, I've got partial dentures, top and bottom. And as Mark said, the fact that you have some of your own teeth does mean that it holds the denture more stable in your mouth. So that helps. It helps that way, and that's what I haven't got many of my own teeth left, because gradually, before Mark became a dentist, I'd had treatment by other dentists, but they tend to sort of look and think, oh yes, your gums are bad there, we'll take that tooth out and we'll pull that out, because I had abscesses in the gums, and I had a perfect set of teeth when I was sort of 30, absolutely perfect set. They looked like dentures. In fact, I know one or two people had asked me in the past. They said, "Where did you get your dentures made?" Because they were so good. But they were my own teeth. Once I started losing them, I had to rely then on a partial denture, a plate, and I found that it depends on the dentist as to how well the plate is made. It's not the dentist that makes the plate, but he takes the cast, he takes the mould to make them. And if the mould is good and he uses a good laboratory to make the denture, then there's less trouble with fitting them as new. And I found that more recently, that my present dentist, no names, no pack drill, but the last sort of couple of sets of teeth that I've had have fitted quite well the first time without needing really any tweaking at all.
Much tweaking. Lots of tweaking. So the problem can be as well. I mean, he can big me up, but he's got to. He's my dad, and I'll make him walk home. But if you think about it, there are different techniques that were taught at different dental schools. So the guys that taught me denture techniques may have taught another dentist the same techniques, whereas someone who's graduated from a different dental school may have been taught a slightly different technique. And unfortunately, one technique does not fit all. So you can get one guy who's really good at dentures, gets one patient coming in, and because of the way they've lost the teeth and the way the mouth is, they'll do the impressions, they'll do their normal technique, which might work great for patient A, but for some reason doesn't work great for patient B. And then you're scratching your head thinking, well, I don't get it, it's not working for this guy. And it is basically because patients, we're all different, and one type of denture might work brilliantly for one person and doesn't work as well for the others. It's one of the things as well. Patients will quite happily get veneers and crowns done, and you're at a party, say, what do you think of my new teeth? And they're all smiling, right? If you get your teeth whitened, you'll show people, say, what do you think of my new teeth? Nobody ever goes to a party and goes, what do you think of my new teeth? And they take their dentures out and show people, these fit really well. They just don't do it. So there's a lot of stigma that way involved in false teeth.